Sermorelin acetate is the functional analog of a hormone produced by the human body known as growth hormone releasing hormone. This hormone stimulates the pituitary gland to produce a vital hormone known as human growth hormone, or HGH for short, which provides immense benefits all throughout the human body. Sermorelin acetate is used for the treatment of human growth hormone deficiency, a medical condition which affects men, women, and children of all ages. By getting doctor-prescribed sermorelin acetate, it is possible to restore normal HGH levels in the body, which protects and preserves optimal health. Treatment of childhood human growth hormone deficiency. Treatment of idiopathic short stature in children. Treatment of adult HGH deficiency. Treatment of adult onset HGH deficiency. Sermorelin acetate is a highly effective medical treatment. Sermorelin is delivered via subcutaneous injection and is utilized quickly by the body over the course of the day, bolstering human growth hormone levels and protecting against the detrimental effects of HGH deficiency. Recombinant sermorelin provides all of the great benefits of bioidentical human growth hormone, including increased muscle mass, enhanced energy levels, increased fat-burning power, improved cognition and memory, stronger, healthier skin, increased sex drive, improved bone mineral density, enhanced mood and psychological profile, stronger immune system, a body more resilient to injury and damage. Although sermorelin does have a positive effect on many symptoms and health conditions which are associated with the aging process, it should not be considered an anti-aging drug. Sermorelin acetate protects the body by increasing the amount of HGH available from the bloodstream to youthful levels. But many of the core processes of aging cannot be effectively treated with sermorelin acetate or human growth hormone. Sermorelin is notable because it has a very low risk of side effects, even lower than bioidentical human growth hormone replacement therapy. This is because the activity of sermorelin and growth hormone releasing hormone are controlled by other hormones such as somatostatins, which prevent the pituitary gland from producing an excess of natural HGH. The following are some of the more common side effects of sermorelin: trouble swallowing, itching, and irritation, pain, and redness at the injection site. The following are some rare side effects of sermorelin to be aware of: trouble staying still, tiredness, headache, flushing, and dizziness. It takes a very small amount of sermorelin acetate to produce powerful effects on a patient's health. Generally, patients will be prescribed between 0.2 and 0.3 micrograms per day, which for almost all patients is all that is needed to restore normal and healthy HGH levels in the body. Sermorelin helps restore muscle strength and health by encouraging the anabolic effects of human growth hormone to become more pronounced. Although human growth hormone is not as potent as testosterone with regards to bodybuilding and muscle strength, it does have a strong impact because human growth hormone stimulates faster healing of the muscles after physical activity, which corresponds directly to enhanced muscle tone and strength. Human growth hormone is a vitally important metabolic hormone, and if your pituitary isn't producing enough, the normal processes of your body aren't running at full efficiency, which means that your metabolism burns fewer calories each day and stores fat easily. Injectable sermorelin acetate can help reverse this trend, helping your body use the calories that you take in and prevent you from storing too much fat. Metabolism is the way that your body provides and circulates energy for use by your various systems. Sermorelin acetate injections can help you work out harder and longer, and they can just give you more energy and pep as you go through the day. This also relates to psychological benefits because the more energy that you have available, the more that your mind has to work with to keep you sharp. Healthy human growth hormone levels are strongly correlated with normalized sleeping patterns. This train runs both ways. It means that if you have bad sleeping habits, your body won't produce enough endogenous HGH. And it also means that if you don't produce enough natural human growth hormone, you won't be able to get a good night's rest. The Sermorelin HGH therapy alternative has a powerful impact on both cognitive and psychological health. By keeping you energized, you can maintain focus and keep your mind engaged more easily. Human growth hormone also has a positive impact on the delicate hormone balance, which preserves a happy and healthy psychological profile. There is strong evidence that Sermorelin acetate can alleviate and ward off depression, helping you maintain enhanced quality of life and peace of mind. Lack of energy, increased fat mass, atrophy of the muscles, trouble remaining focused, issues with cognition and memory, reduced resiliency to injury and illness, depression and mood swings, trouble getting a good night's sleep, significant fatigue both with regard to physical activity and day-to-day activities. In order to qualify for Sermorelin acetate therapy for adult-onset HGH deficiency, you have to prove that you are suffering from clinically deficient human growth hormone levels that are having an active and negative impact on your health and wellness. Our clinic offers hormone replacement and restoration services to men and women over the age of 30. The only way to get legal Sermorelin acetate online is via the prescription of a licensed and board-certified provider. We can help you get in touch with an affiliate endocrinologist in your local area that can provide the preliminary evaluation necessary to get you approval for quality Sermorelin acetate injections. With a simple blood sample and physical, we have all the information we need to make a qualified diagnosis on your personal behalf. We provide generic Sermorelin acetate to our customers as well. Bioidentical human growth hormone is not available as a generic, and it is a longer molecule. For these two reasons, Sermorelin acetate is less expensive than bioidentical HGH treatments. You can look at spending around $29 to $35 per vial for quality, real Sermorelin therapy. As we mentioned previously, one of the biggest advantages of Sermorelin acetate is that it is cheaper than bioidentical human growth hormone. For the same 6 months of treatment, you will pay significantly less for Sermorelin than you will for prescription HGH. Sermorelin acetate is also easier to be approved for than bioidentical HGH. Human growth hormone is tightly regulated and cannot be prescribed off-label by any physician. Sermorelin, on the other hand, is not regulated as tightly, and prescribing hormone physicians are given more leeway to prescribe treatments as they see fit for the treatment of HGH deficiency. The body responds more regularly to Sermorelin acetate than human growth hormone. When you inject yourself with recombinant human growth hormone, you have to be very, very careful, because your body will use all the HGH that you inject. There is no mechanism to protect the body from overdose. When you inject Sermorelin, on the other hand, your brain has mechanisms to prevent your pituitary from producing too much natural human growth hormone, in the form of somatostatins. This means that when you deliver Sermorelin acetate via injection, your body only uses as much as it needs to provide youthful human growth hormone concentrations in the body. No more, no less. Sermorelin is injected once daily between 5 and 7 times per week, as recommended by your prescribing physician. When you inject Sermorelin, your body utilizes it over the course of the next 24 hours, meaning that you have to supply the body with a new dose on a daily basis. Most physicians either recommend injecting Sermorelin acetate first thing in the morning or just before going to sleep. Injecting early has been shown to enhance strength training, while taking the injections at night more closely mimics your own body's natural processes, since the body releases the highest concentrations of both growth hormone, releasing hormone, and human growth hormone while you are in the deepest phases of sleep. When you start Sermorelin therapy for HGH restoration, it is important to recognize that it is a relatively slow process. It isn't like taking cold medicine and seeing results in a matter of hours. Some benefits relating to energy and mood will become noticeable in the first days and weeks of therapy, but changes in muscle, fat, and bone mineral density usually take 2 to 3 months to start to become noticeable. After 6 months of therapy, most patients experience significant benefits in numerous aspects of health and wellness. Yes. For many patients, this is actually the best course of action to protect your health and vitality from the dangers of hormone imbalance and aging. When you choose us to organize your physician-monitored hormone therapy regimen, we will arrange for your blood sample to undergo a comprehensive hormone panel, which will test you for a wide variety of conditions and symptoms related to hormone deficiency, including blood cell count, cholesterol levels, free testosterone levels, and IGF-1 concentrations. By combining HGH restoration with testosterone deficiency treatment, you can kickstart your health with the immense benefits that are offered by these two forms of treatment. HGH deficiency is a fairly common occurrence among aging men and women. If you are over the age of 30 and you are suffering from 3 or more of the symptoms of HGH deficiency that I stated previously, it is quite possible that you are a prime candidate for Sermorelin acetate treatment or injectable human growth hormone therapy. In order to learn more, we encourage you to contact us via the form on our website, which you can access in the link below in the description. We are more than happy to serve you, and we are looking forward to answering any questions that you may have. Thank you for watching.